Still September 9th, 2024. It is 8:36 and the Town of Fairfield Board of Health meeting is called to order. First, before anything else, did everybody have a chance to see the minutes from the meeting from July? Any additions, corrections that need to be made? And then can I have a motion to approve the minutes?
I'll approve the minutes. Sally Connolly.
Second.
All in favor of approving the minutes?
Aye.
Second, so the minutes are approved, and we can move on to Sam's director's report.
Well, I will move as fast as I can due to the late hour, but so as we shared at the July meeting, I believe that Jill was retiring as of August 1st. Jill Mitchell did retire, and we wish her well. We spent a significant portion of the time in between vacations and the like of everybody else's vacation while we're covering them, putting the posting out, selecting candidates, putting a team together to select candidates, and then the interview process, and then going through the hiring process. So we have a new nursing supervisor. Her name is Sarah Payne. We were able to get her started August 26th, just as the school year started, just prior to that. And so she will be coming to next month's meeting, so you get to meet her. But Sarah comes to us from the New Canaan Public School System, where she was a school nurse there for the last 9 years. And prior to that, she was a nurse supervisor at, forgetting the name of the hospital, one of the hospitals in New York. She was a public health nurse in the past. So she's got about 20 years of experience, as well as management and school nursing experience. So we're happy to have her, and she's drinking from a fire hose for these first few weeks. But we were fortunate to have Jill, design and go through an orientation program with her, and then a week later came back for a couple days to help her with transition, and has said she's willing to be available by phone to help with things. But
I'm sorry, just so to be clear, it's Nurse Payne.
I have not referred to her as that, but it's now on the record, Henry. Yes.
Okay.
So in addition, since Jill was retired and Sarah was not hired yet, a lot of the work of the nursing office fell to several other staff members, myself and Santina and the nurse coordinators. And so we did, at the same time, conduct interviews for a few of the full-time and part-time nurse positions that opened up, or shuffled, as you will, when one person jumps from one position to the next. And so, but that we were able to get everybody in place prior to the school year. And then, of course, as things do, just as the school year starts, a couple schools tell us about special things that happen, and then one nurse stepped down, and so we're still doing a little bit of shuffling, but we're able to provide coverage in all the full-time nursing offices, and in the some of the smaller schools we're working with some subs to ensure we have coverage. But so the process of the community, that what you did tonight was a part of the community health needs assessment, the focus group, and that work continued all summer. At one point over the summer, I participated in an hour-plus long interview as one of the key stakeholder interviews. So they did a few dozen of those. They're doing, I think, 14 focus groups. They're doing the random digit dial survey through the Siena Research Institute and Data Haven. And then in addition, this year they developed what's called a community-based asset needs assessment survey, which I sent to all of you probably several times. We were able to send that out through town emails, all the elected officials and boards, through, thanks to Bonnie, our part-time secretary over at nursing, sent it throughout the Fairfield Public School System to all the parents there. And there was somewhat of a competition amongst the HIA members in our area to see who would get the most survey responses. And rest assured, it was Fairfield with 1,152 surveys filled out. And so we were the highest in the state. And I think the right word is smoked our neighbors in the HIA area by more than double. So we're happy about that, but it's really about the quality of data. The more surveys we get, the better the data that we have. And
it's actually too bad that it's so few, right? Because, I mean, it's just limiting the data that you have, relatively few, I mean, great that we did that, but it would have been nice if we had, 10,000, right?
It would have been nice, but in survey research, when you can get up around 1,200 of a population of our size, it's a pretty good response rate. For some variables, I think I've said this before, the 200 or so that they do with the random survey is enough to be generalizable on the big questions, not when you hammer down into the, if you answered yes to this and you're a female with a college education and, the numbers get very small, and so you can't generalize that data. But this helps support that data. So if this data is consistent with that data, it supports it to say that data is accurate and vice versa. So we're happy about that. It was, a lot of work by Santina and Emma Sharp, one of our staff here, to really push that and get it out there. So again, we had some work related to the pertussis, the whooping cough outbreak that's going on throughout the state. State hasn't released recent numbers, and so, but it appears to be slowing in terms of the outbreak curve. The state is really taking the lead on all the case investigation work. So really for us, it's just about getting information out. And so that's what we've been spending a fair amount of time doing. Again, the summer is the time where we meet with the Fairfield Beach area stakeholders meeting. So we met with them, all the condo groups and associations, and Fairfield Beach Peninsula Association, Fairfield Beach Residents Association, to talk about the issues that they're concerned with and sort of plan for the year and what approaches that we're going to try to improve things. So it went well. It's a good meeting. Again, we had various DPH, CDC, NACCHO calls about H5N1 and just kind of monitoring the progress of that, as well as, there were some of those calls were about pertussis, and continued with some activity related to the Medical Reserve Corps, both national, regional, and state calls. We have been working to set our flu clinic dates, and so because we have the immunization grant that we got enables us to hire a few additional staff. So we have an additional part-time nurse and additional community health worker part-time to offer more clinic time. So we've set up, so now we're doing a flu clinic every Monday from 10 to 2. I had our first one today. As expected, it was kind of light because it's still early for that. So we did about 9 people, I think they said. But it's just walk-in, so they're there. And so hopefully it'll grow in popularity when people know that we're available just to walk in. We did get our first batch of COVID vaccine, so we'll be setting up a COVID-only clinic. We've planned our first 2 large clinics that we do every year on the 8th and the 16th of October at the Senior Center. So we'll be holding those. And then a lot of the summer was spent, we talked about the vaccination grant, that there was the component of increasing vaccination opportunities, and then there was a media campaign. And so I thought I would share a little bit about what's going on with the media campaign, and I will try to be quick. So, that's interesting. Do you know how to get out of that?
Yeah, you just switch the view. Oh, well, you've got your presentation on the right. So you just want to flip-flop.
Okay. Well, yeah, I guess I don't know why it's that way. Well, only look at that screen.
I think if you click the same dot, you can swap it out.
Oh, it's the next slide. It just shows.
Yeah, it just shows the next slide.
Coming up.
So part of this campaign, so the first 2 months of this campaign was back to school campaign, and this was the slogan that came out of, add vaccinations to your back to school list. And the intent of most of this content is really to direct people to the new website that was created by the group. So it's 8 or so health departments that have got together and pooled their funding that they all received for media. And so this is one of the billboards in Fairfield. We have 2 in Fairfield, but they run from Darien all the way up to Stratford. And so we have 2 here. One on my way to work from Stratford. We have ones on this is the Fairfield train station one, but there's also on the train station platforms as well. Then we're running Google ads, and you'll see here, up here, this is Fairfield's English. On Google ads, we had 2,500 clicks, 137,000 impressions, meaning appears on the screen, average cost per click of 11 cents, and then that's a 1.86 click-through ratio, so 1.86% of the people actually went to the website. Fairfield did very well on that. Like we're used to, we beat everybody else. And then that was English, and then here's the Spanish, the same. We had 77,000 impressions, click-through rate of 1.98. Meta ads also ran Facebook, Instagram, not as effective in this way, but we had 22,000 in English and 14,000 in Spanish. Basically about 200,000 impressions, but lower cost per click, and then lower click-through ratios. So, and then we the consultant that we hired worked through Hearst Media. So these would banner ad clips would appear on different websites that would be people searching in this area. On the USA Today and Fox News and other websites would these ads would pop up. And this is older data. This is I have it on the next slide. But again, 87,000 impressions from the banner ads. 1,300. That's Spanish over there, English over here. So 2,300 interactions with the ads. So again, this is all about driving eyes. This is actually the totals here is actually, that's the updated one, 206,000 impressions in English and Spanish for the Hearst Media. Then we also had, audio streaming spots, at 63,000 impressions, 61,000 completions of listening to the audio spots. And then the CCT and OTTV relate to impressions on smart TVs through cable providers and devices where people are watching media content. So again, 79,000 impressions, 75,000 completions. Just about getting the word out there to this website that was created by the consultants with input from all the health departments. But basically, taking sort of CDC content, and if you follow through these links, it really hammers down to sort of CDC and other types of content, state content about information. But it's basically helping people to understand, what's required for infant toddlers, school-age children, teens, adults, and for, when you should get those. Our website, when we look at, all that content drove 13,547 individual people to the website with, I think it's 15, what is that word there? Sessions. So it means 13,500 individual users, 15,000 sessions where people interacted with that, and, views, meaning one person could view things more than once. Fairly good results. The consultants told us, these are good results for the value. And so the next thing we're doing is the next campaign. So that campaign has ended. Now we'll do a similar type of thing with flu, COVID, and RSV, seasonal respiratory viruses. We have some fact sheets that will be coming out. as well as the same thing. We'll switch out to this content here about seasonal vaccinations. So the signage and the billboards and the online ads will feature this content, and then after that we will go to a more general content about other reasons to get vaccinated, for if you're traveling for seasons, if you're visiting families, before a trip, about whooping cough, and just sort of general reminders about other reasons to get vaccinated will be post respiratory virus season. We'll transition into that, and then last is we'll also have the same media content on our own websites, within the banners here, and just going to the flu clinics, every Monday, 10 to 2, every Thursday starting October 1st. We're going to have clinics as well by appointment only.
Tuesday, right?
What's that? Every Tuesday, starting October 1st until December 3rd at the nursing office, 8th from 10 to 2 at the senior center, the 16th from 3 to 8 in the evening to focus on families, and then we'll have a special separate COVID clinic, and we're still looking into, whether we will focus on an RSV clinic. Depending, we're sort of looking at the demand for it and to see if it's, because it's pediatricians' offices are pushing it, obstetrics for pregnant women, and then what we might focus on is just it's recommended for folks 75 and older, and so we may focus on that population and try to work that.
I have plans to run like combo flu and COVID clinics, so just give the opportunity to get both at the same time. You might have better compliance potentially.
Yeah,
Or not participation, not compliance, rather.
Yeah, we are considering it, but it's the last time we tried, it wasn't as popular, and it's harder on the nurses to really, the amount of to have the laptop out and to be able to go into each one and do all the questions and stuff. It slows throughput time down significantly. But we are not ruling it out at the smaller clinics. I think it's something that we're going to try to work in as well. So that is my report. I just wanted to share that about the campaign and how that is going. And then I'll turn it over to Rob.
Yes, great.
Hey, Sam. Hi, everyone. So just a couple things I wanted to report on. It's been a while since I was at these meetings with the summertime and so forth. One of the things that we did is myself and the 3 sanitarians renewed their lead inspector's risk assessor certificate through the state of Connecticut, which consisted of a full 1-day course and a multiple choice exam. So we were all able to pass that and receive our certifications again for this year. We also, during the summertime, we were active with water sampling in the beach areas and at Lake Mohegan. It was actually Kim in our office did weekly sampling. She also did the resampling based on rainfall or other closures. It was actually quite an active season with some closures because of rainfall amounts and so on. The new system has made it much easier than in the past. We can do closures very easily just from our phone. It's much easier than in the past. Couple other things that we did is we were able to do school. We did 20 of 24 school inspections again. We did that over a 2-week span of 20 of the schools. We still have 4 remaining throughout the town. All the reports are ready. They're going to be sent to Angeles actually tomorrow morning. We didn't see any major issues in any of the schools in any of the inspections that we did. Just a couple of small, stain sealing tiles, things such as that. It was good that we were able to do them again with COVID. Obviously, there were restrictions at that time, and then we had a little bit of short staffing and training. So myself, I actually asked Ken, who's with us part-time, to come in and help train some of the sanitarians of what to look for during the inspections. So those 20 were done, and we'll be doing the 4 other ones in the near future. This time of the season, or actually the beginning of August, is really the time for student rentals down at Fairfield Beach Road. And as Stan says, we had a meeting with the stakeholders, all the different associations. We so far have been able to do, just in the month of August, over 70 rental inspections just in the beach area, which is a pretty good number for just the month of August. It means that a lot of the landlords are calling in, getting the inspections done ahead of time. Andrea and Chelsea sent out a mass mailing to the beach areas to all the landlords to remind them that they need their certificates, and that unrelated is for unrelated occupants down in the beach area. We do that mailing once a year. We did it, I believe, Andrea, was it 2-3 weeks ago maybe we sent it out?
Yes, 2 weeks ago.
2 weeks ago, and the mailing always seems to help out because we've already gotten, I think, about 5 calls from landlords that do have students renting there and they want us to go and do the inspections, but it's also triggered some of just, for instance, we got a call today from a condo owner that rents his place. He just bought it and he's renting it. He had no idea that he needed a certificate, and it's in the beach area. So that letter was able to let him know that he needed to get a certificate. So that mass mailing always helps with having landlords who may just forget, may not do it, and then realize that they do need to go ahead and do it. On Labor Day, as we've done in the past, myself and Ken went down on Labor Day in the morning during move-in day. We walked down on Lantern Point. We drove up and down Fairfield Beach Road. We attempted to hand out some applications for houses that may not have gotten their certificates. We do walk around. We introduce ourselves as the health department. If any of the tenants have any questions, any of the landlords have questions. And during that time when we do go down in Labor Day, what we do try to do is we do try to identify potential problems down at the beach, meaning overcrowding. We were able to identify at least 2 houses, and then I believe we got a call last week on another house. There's a couple of houses that we are going to monitor, maybe do some early morning surveillance, as we saw that there were a lot of cars at that moment in move-in. Doesn't necessarily mean that it's overcrowded, because when they are moving in, they do have parents, they have people helping them out. But going down there on move-in day does give us an opportunity to maybe seek out some potential problems early enough and to try to take care of it early enough so it doesn't become a problem further into the school year. As far as that is my report for tonight.
Okay, thanks, Rob.
So, were there any communications from?
Yeah, so I'll just briefly mention, I know I did that off the conference call, but received a communication in near the end of July, I believe, somewhere around July 22nd, just from a mom and Fairfield resident who had her son enrolled in the Parks and Recs program, the summer camps program, playgrounds, I guess is what that's called. And just the issue was that he has a type 1 juvenile diabetes diagnosis and a monitoring system. She can explain more of that hopefully later. I won't go into too much detail, but that there was not really an official protocol in place through our town and through the Parks and Rec. So that's something that was keeping that child from being able to participate and prolonged his participation by over a week from the start date of the program, despite the earlier registration and supplying the medical-related paperwork. So just wanted to point that out, hoping that I just wanted to advocate as a Board of Health member, since this resident reached out to me directly, just that it's something that hopefully we'll be able to prioritize through Board of Health and through Parks and Recs and et cetera, that students who have medical-related concerns who don't fall into that category of a special education but are typically developing kids that have some sort of medical concern, that there's a protocol in place so that next summer and the summers moving forward are kind of smooth sailing for the sake of everyone, you know,
Yep.
so there just aren't question marks. So, that's my communication. I'm not sure where does anything else comes later, right? As far as.
Well, I'll just share in terms of so as a result of that, I spoke with Anthony Calabrese, the director of Parks and Rec. And again, I'm not trying to disagree with anything you said. I'm not looking to cast blame it anywhere. But he assured me that going forward, the system will be improved, and that they, in the past, they've had children that require nursing level care, children that require paras, that they've implemented systems in the past to do that, even in the past seasons, while, we don't have nurses on staff in the summer, so it's the health department has never been really involved in that. We were asked by our HR department to assist in trying to find a nurse. That first week, we weren't able to secure, nobody said, yes, I'll do it, from our staff. But the following week, we were able to get a nurse in place for a period of that week.
Right, and just and again, something to just be considering the big picture of everything, just as, let's say, the counselors are educated in those first aid training classes to potentially administer something like an EpiPen or even, God forbid, CPR or something like that. There are certain things that can be administered without a nurse as long as the appropriate training is in place. And certainly if there's an agreement between that parent and someone else on the staff who has been just adequately trained. So there are, things that don't necessarily need to be a nurse if that's been pre-planned. So that was kind of another situation, concern.
Yeah, and what Anthony, and again, I'm just repeating what Anthony said to me, is that, it's just that there was some kind of breakdown in communication that he just wasn't aware, their camp program wasn't aware until a few days prior to, over the weekend, that the camper would be showing up and had these needs. And so he said, they've dealt with things like this before, and had they known earlier, and I know that forms were submitted months earlier, and that I don't understand all the processes there, but what he reassured me is that won't happen again, that we have looked at how we look at things, and we'll make sure that doesn't happen again. And that he just said, this is something we do every summer. We have kids with different needs, and so we always accommodate them. We have, and will continue to. And they've approached, even Jill confirmed, they approach us every summer and say, all right, we have this need. Do any of your nurses want to work in the summer? And so we send it out as a courtesy to them to say.
Well, I'm just thinking proactively moving forward, not even just this issue, but maybe brainstorming a little bit. What are some of the situations that could come up? How can those be addressed so that when it does come up in future, there's just a very clear-cut protocol without delay, so that's because certainly for a resident who's planning on, I remember when my kids were in the Parks and Recs camp, we relied on that from a child care component as well, which many people in Fairfield do utilize the Parks and Recs from that perspective. So to have a last-minute spanner in the works can be very problematic, right? Not everybody has the flexibility. And also just the concern regarding, I think, some confidentiality issues and just a stigma perspective from, for any child who's undergoing sort of medical issue, they should not have to feel excluded and have that come up as an issue. So anyway, I don't want to dwell too much, and you run the show here, so I can't remember how it works as far as when guests are able, public comment comes in at the end or now.
I think we can ask a question before. Is that in regards to this clarification? So, is the health department responsible for providing the medical support for Parks and Rec?
No. No, the health department has no role, we have no legal authority here. Our only role historically has been to offer those positions to nurses that during the school year work for us, so that if they choose to work at a summer camp, they can pick up some extra work during the summer.
But then who acts as advisor? I'm assuming you still, being the town person, have to act as advisor to Parks and Recs.
Parks and Recs would seek out their own advice.
Okay.
Because, just like police and fire, they have their own doctors
Right.
they go to for occupational issues and other issues. The same with rec. They would follow their channels. They have a board as well, Parks and Recreation, I forget what they have a commission, I think. And so that would be sort of Anthony would be the individual to implement it and develop plans, which he says they have. But their board would be part of that, but it's also just a matter of they would have their own channel, Well, again, we're always happy to consult, they call the nurse and talk to the nurse, and we're always happy to consult, but it really doesn't fall under the health department, because I don't have any regulation.
And the reason I ask is because I think you bring up a great point, and these are all excellent, considerations, just looking at the medical and the clinical aspects of all these programs and things like that. So I think you're absolutely right. I just want to make sure that we're not preaching to the choir, because ultimately, if the health department, like for example, when I wear my Stamford hat, I'm the chief medical advisor for the city of Stamford and Stamford Public Schools. When it comes to summer camps, other programs for the city, ultimately, I'm not responsible. It's not my license that's overseeing the nurses and their functionality. There's a whole separate process to that. So that's why I'm asking. Again, I'm not trying to minimize the importance of it. I think everything that you're saying is valid and important, but I would hate to come down on Sands for not doing something that.
No, and I don't think Sally is in any way. No,
I mean, I'm just like, the question is communications, and that was, certainly a communication that should be communicated.
It sounds to me like it's hard. It would be hard to set up a particular protocol for every possible medical need. However, the bottom line is that if a child has type 1 diabetes, should be able to participate like anyone else, without any hesitation. I think that to me it sounds like it was just a communication lack, because if the Parks and Recreation, the people who run that, if they know that a child is coming, wants to participate in the program in the summer, that they would take the responsibility to find somebody. It doesn't necessarily have to be a nurse. It has to be somebody who's familiar with whatever glucose monitoring system. If it's the Libre or it's the Dexcom, there are a couple of ones that are really very well known, and a lot of people know about them. I do, because I wear one. But I think that in terms of any stigma or that kind of thing, I think that would be terrible, because it's a medical condition like any other, and they.
Right, but then to know that you were supposed to go to something and then couldn't for a week, then that was created unintentionally, but
it sounds
still
like it was
occurred.
totally unintentional, and I think that the Parks and Recreation Department does a good job. It sounds like somewhere there was a lack of communication. So if we had some process in place where somebody was aware. The monitors these days are so good. If the sugar is trending down, it's getting to a lower level, it goes below 70, whatever the critical level is, it will alarm. And it just has to be somebody who recognizes it. I think now is probably a good time to talk about it.
So may I ask, who, just for checks and balances, who not oversees, but who checks to make sure that, these other departments, these other facets of the town are upholding what they need to be doing for that? Because what was actually experienced was not just a breakdown of communication, it was just a complete lack of knowledge of how to handle the situation from top to bottom. And I don't think it's that they, I'm sure you were reassured that they do this all the time for different people, but from what we experienced, they looked like a deer in the headlights. And Like, they had never experienced trying to make any sort of accommodations and were flatly refusing to make reasonable accommodations, taking ADA law that was specific to type 1 diabetes and summer camps that spells out how municipalities should be handling these situations, and saying to our face, no, it doesn't matter, we don't care, you don't belong here. It was more than just the fact that the forms were submitted in February and nobody downloaded it until we were specifically told the week before camp started. And then even that week before camp started, nobody looked at it and reached out to us. And it wasn't until Friday evening when I got the camp director's contact information, like every other parent, and reached out to them directly, that the conversation even started. And it wasn't until I argued with them, saying, you don't seem to, like, be hearing that, like, what you are doing is actually against the law, and I don't want this to be a legal problem. So, like, can we at least have a conversation about reasonable accommodation? Being told no, 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 having it come up to HR and then go to your office. And that was the first time you even heard about it. That whole progression is a much bigger issue than it being a breakdown of communication. It's that there's an entity of the town that is not handling medical consideration appropriately. And that's something that I think was our biggest concern. It was more than, like, just a missed target.
Right, but to answer your original question, or to answer in the negative, the answer, I don't know the answer, but I am fairly confident the answer to your question is, it's not the health department who's responsible.
Yeah, who would that
So I
be?
don't know, but I just want to make sure, unless you're mistaken,
You know?
because ultimately the director of health reports to this board.
Right.
So before I take on that responsibility of saying something at the Board of Health didn't do properly, I want to make sure, is it within our...
No, and I don't think anybody's saying it's not us, you know, we have no role, we have no authority.
Right.
We were asked to assist.
Yeah.
We did the best we could, wasn't perfect.
Yeah.
But I think, you know, in terms of, you know, how do you move forward with this? I would, you know, if you think you're going to be using the Fairfield Public Recreation Department camps in the future, I would, you know, work through them to say, I want to be sure, and, you know, to say, please, you know.
We can be as explicit as we can, and this includes us going through this entire procedure last year as well, and not having the same reaction because the camp director took it upon themselves to make the reasonable accommodations and figure it out, and that worked out really well. When it goes up the chain of everybody else who doesn't have a direct touch with the campers and doesn't, you know, work directly with the families to, like, get into the nitty-gritty, and then they're faced with, there's a problem, we don't know how to handle it, and nobody up the line knows how to handle it properly until they're like, we don't know what to do, and call you. That is more of the problem. So, like, what we're hoping for is figuring out a way, like, what avenue would be the appropriate way to get, like, a policy in place for how to handle that in the future, so that the Parks and Rec Department knows, like, how to handle a situation. There's precedent with other towns that these kinds of things are in place.
Yeah.
And they had to go through legal action to get there. Obviously, that's not something that we want to happen, but, you know.
And I don't think it's necessary. My suggestion would just be to talk to the Parks and Rec Department, talk to the director, and just say, hey, you know, just so we never go through this before, why don't you show me your policy, you know?
They don't have one. That's the problem.
Yeah, then.
So I want to interject now and just say, I think where we're getting into a little bit of a kind of endless loop here is just that when maybe it is something that does need to be looked at from a different perspective, and yes, I don't think it was necessarily your fault or necessarily completely Parks and Rec's fault. The issue seems like, since concerns do come up that are maybe medical or health related in nature, probably like Parks and Rec might also not feel like they have the authority to make some of those decisions. So I think if a knee-jerk reaction is just to go to the town lawyer or something, that seems like really premature. And that if there is a precedent, and I did read it because she also did forward one of the policies that was in place, I believe from Rocky Hill, to me via email, is there's just like a very straightforward policy that's kind of tied into health department, right, and the summer camps as far as how to address medical-related issues. So I just think that it's something that probably should be explored for future, because it's kind of a little bit of a passing the buck thing is what seemed, based on the communications that
So
we
maybe
had.
it's a suggestion, we can offline, maybe if you had a conversation with Anthony, and what if it was similar to with the schools, right? The school board enacts a policy that we suggest to them and say this is a good practice, and they formally adopt it, right? We can't actually affect their policies, but we review them and we say, yes, this sounds good. Maybe we can offer something similar for Parks and Rec Department as the other large organization in town that has oversight of children and their health potentially.
Because it's not like a blame game thing here. That's not the point. It's not, because like hindsight is 20/20, right? For anybody, that's just like the way it is. But the fact that it worked out without a problem 2 years ago, and then didn't this year for the exact same camp, but just at a different location, just doesn't make sense. That just is not like logical. So then moving forward, there can't be like an inconsistent situation based on who just happens to be the point person that year. The policy is just a policy, and we have it for basically everything else. Think about what they had to go through for the allergy policies. Yes, that was in the schools, but, back when my kids were younger, we were bringing in cupcakes,
Yeah.
You can't do that anymore. Things change because something occurs that necessitates that change, so.
Yeah, and I think,
Anyway.
so we, again, we're lateral to Parks and Rec.
Right.
There's no tie from the Board of Health to Parks and Rec. There's no charter code or ordinance that says the Board of Health shall direct the activities of Parks and Rec, but Parks and Rec reports to, the same way we do, in some areas, to HR, to the risk management of HR. They consult with the town attorney on making sure policies and practices about how we operate as a town are proper. And there's a town medical advisor that can consult with HR to put in place what is a prudent policy. We deal with children with a variety of needs every year, and the nurses have great skill in sort of knowing what are the best practices. You worked with several of our nurses this past summer. I hope you found them cooperative and trying to work with you to make it happen as quickly as possible.
Once we got the communication going with your department, things actually started moving forward, and that was wonderful.
Yeah.
The problem was I think, just a lack of information for the other department, and continuing to pass the buck up the line all the way to the town lawyer and HR about it, when it didn't need to be that situation. They just weren't informed. They didn't know how to handle the situation.
Yeah, anybody's going to feel uncomfortable trying to make decisions on something that's not their area of expertise. So if they're lateral, then okay, that collaborative relationship, then maybe it isn't this formal hierarchy, but just okay, how can we work together to create something that really works for everyone moving forward, And who are the parameters? Does it have to be a nurse or no?
I'm happy to
have a counselor.
Have a conversation.
Who's just trained every year now, alongside the first aid, CPR, and EpiPen and situation, right? It's oh cool, now we have people who understand this as well.
Yep. I'm happy to have a conversation with them. I have to be careful. I can't I don't have the authority to direct him.
No,
You know, but, you know, we have a good relationship, happy to have, just to say, hey, you know,
hey,
you
everyone
should have a policy, should be
things
signed off by the
easier.
town medical advisor,
That
it
makes
should be
things
consistent with
easier.
law,
Yeah,
and
exactly.
make sure that none of the, you know, we're not, you know, I mean, the town works hard not to discriminate against anybody. That shouldn't be the practice, and that's, I think, why HR got concerned about this and sort of started working with us to try and implement solutions.
Yeah, and I do think that, you know, just being able to, have at hand, like, there are policies from the state already regarding this. There's policies already from other towns who have been down this road before and implemented these kind of policies. You know, we don't have to reinvent the wheel here or anything like that. It's just a matter of providing consistent guidelines for our town so that we have something that's part of, you know, a series of references for, you know, for all the departments in areas where they may not have that level of expertise.
Mm-hmm.
Okay?
Thank you.
All right,
All right, so was there any old business?
None.
Any new business?
Have none?
Good, so I guess, can I have a motion to adjourn the meeting? Okay, so meeting is adjourned.
All right.
Thank you.
Thanks, Mary Fran.